Good morning. My name is Madhukar Trivedi. I'm a professor of psychiatry at UT Southwestern Medical Center and the director of the Center for Depression Research and Clinical Care. In many ways, this is now a very exciting time for diagnosis and treatment of depression. The recognition that this is an important serious illness is now well accepted. We have also learned quite a lot about how best to measure the symptoms, and diagnosis is now much clearer. We also have recognized that routine measurements and measurement-based driven care really improves outcomes. There's now very good evidence that treatments of depression, when monitored and measured on a routine basis, can help guide treatment so that you get to the best match for the patient. There are also several new developments happening with novel antidepressant treatments being developed that are different from just a traditional SSRI or an SNRI. So therefore, we are broadening our scope of changes in neurotransmitter systems in terms of looking at dopaminergic systems, as well as going beyond the monoaminergic systems into GABA and glutamate systems to enhance and increase our array of antidepressant treatments available. But even more importantly, I think we are beginning to get a much better idea of biomarkers that are helping us divide subgroups into major subgroups that can be used to match patients with the right treatments. So inflammation has now been much more studied over the last 10 years, and we have a better idea of where to match patients when they have some evidence of inflammation, so that we have published and others have published suggesting that if patients have some evidence of inflammation, that traditional SSRIs and SRI may not be as effective, than going to other treatments like bupropion or other non-SSRI treatments may be much more useful. There's also exciting evidence now coming from neuroimaging studies to identify different circuits that are abnormal that may actually help us guide and select treatments based on the dysfunction the patient has, so that we are moving much more into traditional medicine where we identify what the pathology is and then match the patient with the right treatment, which is why there is now an increasing interest in magnetic stimulation and other treatments that go beyond just medications. Exercise is another treatment that has been shown to have anti-inflammatory effects and that is shown to be efficacious in the treatment of depression. So therefore, our expanding array of treatments hopefully will improve the larger number of patients getting the right treatment and in the process reduce the morbidity associated with it. We have to recognize that depression is a very serious illness. 20 million people in the United States have depression. 5 to 6 million of them we classify as treatment resistant. That is, those for whom traditional antidepressants have not worked. So new treatments are really badly needed. We also know the rates of suicide are going up. We have about 45,000 suicides a year. And more importantly, we have good evidence to show that the disability associated with depression is significant, and life expectancy can be reduced by up to 10 years if patients with depression are not well treated. So diagnosing patients very early, making sure that the treatments are aggressive and match with the patient's pathology, and ensuring patients get to remission and stay in remission should be the goals of treatment. Thank you very much.